Welcome back. We saw an interview with a real doctor. We saw a segment on Back to Med School where we kind of taught you about anesthesia. And now we're going to have a real patient. Mr. Fernandez is going to undergo an implantation of a morphine pump. We saw the decisions that Dr. Rodriguez had to make to prepare for the anesthesia. Let's go watch the anesthetic.
Right now we're just applying all the leads for his EKG, placing a blood pressure cuff on him and a pulse oximeter so that we can monitor his vital signs during the procedure. We'll take one set of vital signs before we get started to make sure everything is fine and use that as our baseline. This is some Versed. It's a calming agent to just get everything set up before we get going. We'll then start opening up the IV, let the fluid run a little bit faster as it gets into his system. This drug is propofol. It's the actual anesthetic. And what we do is give him a small test dose to see how he's going to react to it. Everybody is an individual and people have different reactions to the medications as we tailor this to the individual patient.
So that's just to kind of help him get comfortable and also not remember, right?
Correct. This will provide some pain relief. It also provides some relaxation and some amnesia for the whole procedure. You might feel a little stinging in your arm as the medicine gets going. It's not going to last long, but it might sting just a bit.
Give us an example of an unusual response you could maybe have.
They could have a major drop in the blood pressure, some type of rhythm change in his heart rate, or any type of rash, flushing, anything like that that would indicate that something isn't going right.
That's not very common, is it?
It's very rare. In today's medications and with the monitors that we have, it's 1 in every 15,000 is a fairly large number. We'll start injecting the rest of the medication. This will actually induce the anesthetic, and he'll be falling off to sleep. Give him a little oxygen as his breathing is going to start slowing down. We check for a lid reflex. It's one of the last things that goes before you fall asleep. As you can see, he doesn't move to that.
So if it doesn't move, it means he's getting pretty sleepy.
That means he's very sleepy. It's a reflex response. If somebody pokes you in the eye, you're going to react to it. We then start administering the oxygen and some of the other anesthetics that you actually breathe in. We put an oral airway in.
Now that's for just to get more air.
That's to get more air. It's the first thing that we have to establish as an airway. It's the most important thing in an anesthetic because that's what will cause the most serious problems that we don't have.
So all this, what we see here, is this kind of little, is just a vapor.
That's a vapor as he's actually breathing. He's still breathing on his own. You can see the bag is still, that's him breathing on his own.
Good.
In this particular operation, we don't need the paralysis, and with this LMA, we don't need to paralyze them to actually get the breathing tube into their airway.
This is the area we're going to get into his airway?
This is what we're going to use to get into his airway.
Slowly, put your left hand out of the way.
We slip that in, put some air into the cuff to get a seal, and then hook him back up to our oxygen. And you can see the actual vapor coming in as he's breathing. Once again, he's breathing on his own.
Very good.
And then we just secure it with some tape. We secure the eyelids because the anesthetic stops the eye from actually tearing, and we don't want to run the risk of causing some type of irritation to the eyes. And we're ready to proceed with the surgery.
Here we are at the end of the procedure. The patient's done well. We've closed the incision. How's he doing, Armand?
Doing terrific.
Doing good?
Take the air out of the cuff. We remove it. It's disposable. And we'll have him awake here in just a couple of minutes. Surgery just finished, okay? You're waking up. You did great. Go to the recovery room. All right. Perfect.
Everything looks good. All right, guys, take
You
care.
did great, okay? It's all done.
Thank you, doctor.
You're welcome. Welcome back. I hope you enjoyed that segment. As you can tell, there's many doctors, nurses, and other staff in the operating room to make sure you do well with anesthesia and with surgery. We'll be right back.